Health Watch, new data has revealed the numbers of diabetes cases, people diagnosed with diabetes in the U.S. has actually dropped. But obesity rates are rising. CDC researchers found diabetes cases in the U.S. actually fell by 35% since a peak in 2009. But despite that decline, health experts still don't know what's driving this trend. It's actually a complete reversal from earlier data. According to the CDC, from 1990 to 2009, the number of people living with a diabetes diagnosis increased by 4.4% per year. That's about 21 million people in the U.S. with diabetes. Dr. Bernard Benedetto is a surgeon, and he joins us now from Portsmouth, New Hampshire, with more. So, doctor, tell me a little bit more. Why is there this divide? You see the drop in diabetes cases, but why is there this rise in obesity?
Well, that's a great question, Rena. We've been struggling with this as a medical field for a while. We've seen the trend of decreasing incidence of diabetes in the literature for several years, but we're just not seeing that on the ground. There's a lot of controversy right now about how relevant that is. Are the findings just an academic exercise, or should they really impact health policy and practice? And that's something that's pretty hotly debated.
Can you explain really what the correlation is between diabetes and obesity?
Well, you can't have any discussion about diabetes without talking about without talking about morbid obesity. The trend in epidemics of type 2 diabetes and morbid obesity linked together. And as you mentioned earlier, the obesity epidemic has done nothing but worsen during the past decades, despite the fact that we've seen some decrease in the incidence of new diagnosis of type 2 diabetes.
So, at first, the news about the decline in diabetes diagnosis sounded great. But why are health experts, including the author of this report, expressing caution over these findings?
Well, I think the reason that we're expressing caution is that in science and medicine, you want things to make sense. And this doesn't necessarily make sense. The number one drivers of diabetes, primarily morbid obesity and prediabetes, which has actually been exploding over the course of the last decade, they've gone up. So while we're seeing reports of decreased diabetes, the incidence and the total number of people living with diabetes is still at an all-time high, and it's more than tripled since the 90s. The danger here is that people can say, well, we've won the war against diabetes. We can focus on another problem now. And nothing could be further from the truth. We still need to focus on education and prevention. We need to address the obesity epidemic. We need to either prevent obesity and the development of diabetes, or we need to utilize the most effective treatments out there, whether they're medical or whether they involve bariatric surgery, which is really the single most impactful intervention that you can make in any patient who is morbidly obese and a diabetic.
The way doctors test and diagnose diabetes has also changed over the years. How do you think that plays a role in how these diabetes cases have dropped?
That's an excellent point, Rena. Back in 1997, we had a change in the cutoff for what actually constituted a diabetic in terms of blood glucose. And then in 2010, we introduced a hemoglobin A1C level of greater than 6.5 as a new criteria for diabetes. So whenever you're interpreting this data, you have to realize that we've had shifting diagnoses, we've had shifting ways that we've reported and collected this data, we've had a lot of variables that could explain why these numbers are dropping, and could also explain the fact that we're really not seeing a decrease in obesity, prediabetes, and type 2 diabetes when we're taking care of our patients in the office and in our operating room.
So bottom line, Dr. Benedetto, what do you think could be done to prevent diabetes and obesity?
I think you cannot impact the diabetes epidemic without first addressing the obesity epidemic. We need to get more public education about proper eating, healthy activity levels. We need to try and do more early intervention when somebody's diagnosed as a pre-diabetic. Then we need to make sure that they are making healthy choices, that they are getting guidance from their physician to try and prevent them from slipping into diabetes. And we really need to then address the patients who already have developed type 2 diabetes and already have morbid obesity, rather than just sort of putting a Band-Aid on them. We need to really try and make sure that we're maximizing the utilization of bariatric surgery and other interventions that can really impactfully and meaningfully change their lives.
Dr. Bernard Benedetto, thank you very much for joining us.
Thank you so much, Rena.